Common cold, flu or influenza and COVID-19 are responsible on upper respiratory tract infections. The majority of cases accounts on common cold. Common cold can be caused by more than 200 different viruses. Common cold symptoms include runny nose, stuffy nose, sore throat, mild headache, cough, sneezing, sometimes fever. There is no specific treatment or prevention for common cold. Treatment include management of symptoms. Nasal decongestants for runny nose and nasal congestion. Nasal decongestants are available as pills, nasal sprays, and liquid drops. Generally, they aren't recommended for children who are 3 years or younger. Oxymetazoline, topical decongestant and vasoconstrictor medication. It is sold as nasal spray or nasal drops. It is effective to treat congestion in the nose. But important side effect is rebound effect, which means congestion because of using the medication. For this reason, oxymetazoline is not recommended for more than 3 days. Phenylephrine. Phenylephrine can be taken by mouth as a nasal spray. Phenylephrine used for runny nose and congestion. Phenylephrine is a selective 1-adrenergic receptor agonist which results in the constriction of both arteries and veins. The effectiveness of phenylephrine for congestion is under question mark. There are several studies which conclude effectiveness of phenylephrine, but there are controversial studies also. The primary side effect of phenylephrine is high blood pressure. People with a history of anxiety or panic disorders, or on anticonvulsant medication for epilepsy should not take this substance. Pseudoephedrine, PSE, is also a sympathomimetic drug. It can be used as decongestant, and in higher doses it is used as a stimulant, or as a wakefulness-promoting agent. Pseudoephedrine can be used either as oral or as topical decongestant. Pseudoephedrine is indicated for the treatment of nasal congestion, sinus congestion, and eustachian tube congestion. Common adverse drug reactions, ADRs, associated with pseudoephedrine therapy include central nervous system stimulation, insomnia, nervousness, excitability, dizziness, and anxiety. Cough control. Guaifenesin is currently the only expectorant on the market in the United States that the Food and Drug Administration, FDA, have approved. Guaifenesin reduces the stickiness of mucus by hydrating it, which makes it easier for people to cough up. Guaifenesin, a safe and effective expectorant for treating mucus-related symptoms in upper respiratory tract infections and stable chronic bronchitis. Potassium iodide. This drug helps loosen mucus and make it easier to cough up. It does this by increasing respiratory secretions, which are more fluid than phlegm. Menthol. Menthol provides a cooling sensation that can soothe a sore throat. According to some studies, menthol may relax the airway muscles, allowing more air to enter the respiratory system and helping improve cough and cold symptoms. Antihistamines. Antihistamines may provide some relief of symptoms related to the release of histamine in your body. These can include sneezing, itchy ears and eyes, watery eyes, coughing, nasal discharge. Examples of antihistamines available as OTC are: first generation brompheniramine, chlorpheniramine, diphenhydramine, and doxylamine. These above-mentioned antihistamines are non-selective and can cause side effects like drowsiness, sleepiness, and sedation. Second-generation antihistamines have less side effects. For example, cetirizine, Zyrtec, fexofenadine, Allegra, loratadine, Claritin. For pain management, non-steroidal anti-inflammatory drugs are used. Most common pain relievers are acetaminophen, Tylenol, ibuprofen, Advil, Motrin, and naproxen, Aleve. Both vitamin C and zinc are essential for production of infection-fighting neutrophils. Without adequate levels, you're an easy mark for all types of infections. Evidence shows zinc may shorten the duration of a cold, especially in adults if taken within 24 hours of the onset of symptoms. Avoid zinc nasal spray as it may lead to permanent loss of smell. Echinacea may help strengthen the immune system by stimulating the activity of white blood cells, but there is little evidence that it can prevent colds in particular.